Today, I'm going to discuss two label changes from the FDA, one for Dulaglutide and one for Canagliflozin. So the Dulaglutide label change basically allows for two higher doses to be used in the treatment of type 2 diabetes. The data for this change came from the Award 11 trial, which was a phase 3 randomized controlled trial involving 1,842 participants with type 2 diabetes. They basically compared the safety and efficacy of two new doses of Dula, 3 milligrams and 4.5 milligrams compared to 1.5 milligrams, the dose we traditionally use. And basically what they showed was that there was an increased reduction in A1C and more weight loss with the higher doses. So at 1.5 milligrams weekly, there was a 1.5% reduction in A1C and a 6.8-pound weight loss. In the 3 milligram group, there was a 1.7% A1C reduction and a weight loss of 8.8 pounds. And in the 4.5 milligram dose group, there was a 1.9% A1C reduction and a weight loss of 10.4 pounds. Now, this was not associated with an increased risk of side effects, but what I suggest is going up slowly in order to help patients avoid getting the GI side effects that we see with these agents. So I would start with 0.75 milligrams once a week for a month, then use 1.5 milligram for a month, then 3 milligrams for a month, and if you need to continue upward, use the 4.5 milligram dose from there on. So these label changes, these new formulations, should be on the market soon, and it's just another option for your patients who need more A1C reduction and a higher dose of a GLP-1 receptor agonist. With regards to Canagliflozin, the FDA dropped the black box warning regarding lower extremity amputation. And I think this is really good news because basically it means that the danger isn't what we once thought. So what the FDA says is they reviewed new data from the clinical trials that demonstrate additional heart and renal-related benefits of Canagliflozin, and that they determined that amputation risk, while still increased, is lower than previously thought. So what the FDA now recommends is that patients on Canagliflozin should receive preventive foot care and be monitored for any changes such as pain, tenderness, soreness, ulcers, and infections in the legs and feet. And obviously, if you have a patient who's at very high risk for amputation, who's had amputation, you really need to weigh risks and benefits. And the FDA just says that prescribers should weigh a patient's risk for amputation when selecting anti-diabetic medicines. So it is still in the label, but it's not a black box warning. And again, I think this is good news because the FDA says the risk isn't as high as they once thought it was. This has been Dr. Ann Peters for Medscape. Thank you.